Or I think Dennis honestly would, because I think he was miffed. He didn't get.
Dr. Morse, we're all set. Dr. Morse, we can't hear you. You might be on mute.
Yeah. Once I started sharing my screen, I couldn't find the mute button anymore. So, all right. Thanks for joining us. As usual, we have a bit to go through and then we'll get to questions and answers. If you have questions, you can type them into the chat box. All right. So, I wanted to point out that there are some new international travel requirements that are coming on the 26th. These are effective right now for the United Kingdom, but starting on the 26th, anyone that's coming into the US from another country will need to be tested for COVID no more than 3 days before their flight departs for the US, and they have to have proof of a negative test result. If they don't have their results yet, they'll have to delay their travel. And then once they're back home, it's still recommended that they get tested 3 to 5 days after they return back to the US and stay home for 7 days. And if they test negative, it's recommended they stay home for 7 to 10 days. So I just wanted to point that out as we get closer to times when people are traveling. I really, don't know how well other countries will be able to test. So people really need to be mindful of that. I did find on the CDC website, they do have something called the Travel Planner. This is only for domestic travel. So you can put in your destination domestically, so for the United States, and it'll let you know what restrictions there are for that location. So for instance, for Michigan, it talks about, how we have no in-person dining right now, different gathering limits, things like that, so that if you are traveling, once you get there, what types of things may be happening. The other thing I found, this website actually is talking about where you can travel because it's kind of promoting travel, but it was nice. You set them to say where you're leaving from, and it talks about what restrictions there are. So looking at the world, if I said I was leaving from the US, that's why it's blue, all of the countries in red are not allowing any tourists. So again, if you have people that are thinking about leaving, this is, I think, just kind of useful to show the situation. Again, on the 28th, I think things will be different. We might have more yellows and things. And then for the US, it also has what different states are doing. And if you hover over them, it gives you more explanation. And then you can also sign up for alerts if anything changes with a particular state or country. So I'm just sharing that because, again, I know that's always a question is travel. The recommendations for domestic travel in terms of quarantine and things, none of that's changed. It's still more of an optional thing. But again, it's going to be more and more difficult for people to travel internationally because of the testing, and that's because of the increased presence of new strains or new variants that we're seeing. This has to do with vaccines. There's a really nice communication toolkit available, and we'll share this link, but basically if you go to the vaccine section on the website of the CDC, there's a tab for toolkits. There's one for essential workers. They have one also for community organizations. But it has Word documents that have sample letters for you to give to your employees. They have FAQs. They have tons of different posters. So lots of stuff that you can use to help educate your staff and encourage vaccination. I know that I've had some questions about how to handle symptoms after vaccination. I actually found this the other day and was working on it, but I also found looking at the toolkit today that this link is in one of the FAQs in the toolkit. This link goes to suggestions for healthcare providers. It's really technically written. So yesterday I was working on rewriting it, and I will get out the final rewrite. I have it all done. We'll send it out with the slides, and or depending on which health department, we'll also get it posted on our website, so you'll have a copy. But basically, one of the main points, this is a table that is in that document. And again, this is just a simplified wording of what was available for the healthcare providers. It's the same recommendations, but basically, if you have an employee who's having symptoms that are not typical for vaccination side effects, but are typical for COVID, like cough, shortness of breath, runny nose, sore throat, loss of taste or smell, then you need to exclude them for work, do the usual thing. If you have people that have, and this is people who've had a vaccine within 3 days, if they have fever, tiredness, fatigue, headache, joint pain, muscle aches, if they don't have a fever, and they don't have any of these other more focused symptoms, then they can come to work. But they do need to let their supervisor or whoever their point of contact is know if they're not getting better within a couple of days. It is recommended, though, that people that have a fever, which again is over 100.4, be excluded from work and evaluated for infection. So those are the recommendations of how to deal with symptoms after vaccination. And honestly, what we see most of all are the aches and pains and fatigue. We don't see a lot of significant fever. So again, I'll get this out to you guys, and hopefully that will help with any concerns. It also has tips in there on, ways you can schedule and, make recommendations to your staff to help minimize any of these issues and disruptions. So again, we ask you just continue to be patient with us. We're working to get everybody vaccinated as quickly as we can. I was asked to just pass along a couple of reminders. Your staff will need to be vaccinated in the county they either live in or that they work in. So if you have staff that happen to be in your ISD, but their school is in a different county and they live in a different county, they need to get vaccinated in that other county, just with regards to how our vaccine is accounted for. And at this time, we also are vaccinating those essential workers that have direct contact with children. So the people that are dealing with populations that have distancing issues. So we've had some calls apparently from school board members and others who really are not in a high risk occupation. And so, those individuals, unless their age is over 65, would need to wait. Just a reminder on vaccine scheduling, again, likelihood is we'll be contacting you or you'll be talking to us directly, but there is more information on our websites. This data just came out, the date says the 19th, but it was just posted on the internet today, so I was able to throw in a good review of data. So Michigan is number 23 out of 50 for the highest number of cases, total cases, not per capita. 14th for the highest number of deaths. In terms of case rate, so cases per population, we were 46 out of 50, so that's pretty good. 23 out of 50 for death rate over the last 7 days. We're 34 out of 50 for hospitalization rates and 16 out of 50 for ICU rates. So our case rates have kind of leveled off, and they've been leveled off for the last 3 weeks, showing suggestion that they might want to tip in the downward trend. And the percent positivity of our test rates has been decreasing, and the number of tests we're doing is actually increasing, so that's good as well. So here's just some images of that. The top one here is our testing positivity. The daily cases per million, again, I want to say that's a good trend, but this bar here says that these days might be a delay in reporting. Those cases, or these dates, this is onset of symptoms, so these dates, people might still be waiting for their test results. And then the hospitalization rate is kind of leveling off. Our regions here, we have 2, 6, 4, and 5. We have different numberings for different things. But our positivities for these areas are right around 8%. The case rates are between, looks like 281 to 321. Again, we just have Gladwin and Aranac County here. This is not anywhere near what their rates are because we have Saginaw and Genesee County in here. So that's why it's hard sometimes to look at regions. Just a blow up of our 7-day rolling average and daily case counts. Again, these last few days here might just be a delay in reporting, but again, this plateau is hopefully going in the right direction. So looking hopeful. Our testing turnaround time is pretty consistent still. It's right around where it's been the last couple of weeks. So very realistic and very reasonable turnaround times. The school outbreaks, the way they're reporting this is a little different. So this is actually the number of cases on the left side, and then on the right, there's a number of outbreaks and the range of cases per outbreak. So honestly, though, the numbers of cases is quite low relative to how things have been in the past. And total numbers of outbreaks are also quite low. So hopefully that trend will continue. But yeah, just a little bit of a different way to look at it there. Hospitalization rates are going down. This is just from June, but to look at it from the beginning, because again, we were way up there like we were before. We're getting down below where we were in the beginning. These are all the different regions. We are for this type of region, we're regions 1, 3, 6, and 7. So again, 1, 3, 6, and 7. Everybody's going in the right direction. So fingers crossed, fingers crossed. You may recall this slide. This just shows what % of our cases are being fully, the case investigation is fully completed, whether that's because, we've been able to complete it, the state's been able to complete it, the people we're calling have answered the phone, those types of things. This was the first week of January and 49% were completed. This week, there's a lot less cases that were reported, but also 76% were completed. So much, much better. You remember not that long ago, we were only getting 20-some% fully completed. Right around 42 to 43% of people have said that they knew where they got infected, which again is higher than it had been in the past. And about a quarter of people were in quarantine at the time that they were contacted, which is about the same. Just to retouch on the variant that has been making news. We talked about this last week, but as of yesterday, and there is some delay in reporting, but there were 144 cases that have been found in the US. There's likely many, many more because we don't genetically test every single strain. But that's how many have been found in the dark blue states. So our state lab did identify a sample that was positive, an individual who had just returned from England, and interestingly, their pre-travel test was negative. So that's the limitations of testing, is we're not always positive when we're early in our infection. It does appear that our vaccinations should work against this variant. It is more communicable. It does seem to be more contagious. So it's really, really important now more than ever that we do mask, we do wash our hands, we do keep our distance from people, we don't gather in groups, things like that. Especially if, you know, our things start opening back up a little bit, like was alluded to when the governor made the new, or when the new epidemic order was presented the last time. We just have to really, really be careful because this can spread pretty quickly, and I'll show that in a second. This was a projection. So these are all still from that report that is on the state website. This was a projection that was put out by University of Michigan. The reproduction time, which is the RT, in Michigan right now, because of our control methods, basically for every case of COVID, just under one new case develops. So because it's less than one, that means our overall cases are decreasing. If we don't do anything to prevent it, usually it's 2 to 4 cases for every case. Looking at the data in other countries from this variant, the R naught is at least, or sorry, RT, you can also call it R naught, but is 1.5. So we get 1.5, so basically 1 to 2 new cases for every case for this variant. So it's just more contagious. So it's predicted as this variant takes over for our current variant, which it is expected to do because it's more contagious. Our curve, so this is from October on the bottom, and on the top it's from the beginning. Our curve is expected to do what this orange line here is doing, even if we keep doing everything we've been doing. So unfortunately, if things go the way math expects it to go, we should expect to see an increase in cases around March. So that's kind of a bummer. All right. Come on. Huh. So here is the data from the MyStart map for all the counties. So again, the percent positivity is down. This is for the 6 counties in Central Michigan District Health Department. The overall average is up a little bit, but it's still showing that things are still on a downward trend. So again, it's just kind of on that. I did a talk earlier this week, and a epidemiologist from U of M was on there, and she said we're in the middle of a wobbly plateau, and I thought that was a good analogy. So basically, we're just kind of bumping around right now. So hopefully we'll continue overall in a downward trend, but these daily case counts are just kind of wobbly. So again, we're not drastically increasing, we're just not drastically decreasing either. We're just kind of wobbly. I thought that was a really good analogy. At least our percent positivity for the most part is going down. District 10, their percentile is actually up a little bit according to this. Actually, you know what? Forget everything I just said because I'm actually on last week's data. So let's just rewind. I was kind of wondering why everything looked a little bit depressing. Okay, Sorry about that. So much better looking here this week. So the case counts went down from 273 to 188 per million. And the percent positivity went from 9.9 to 5.7 for those 6 counties in Central. And Roscommon actually got down out of that highest category. For the counties in District 10, we actually had 3 counties that got out of that highest category. And likewise, their percentile dropped about 2 percentile points, and case count went from 230 to 209. And then for the 3 counties in mid, likewise, their percent positivity dropped quite a bit, and their case counts dropped quite a bit as well. So again, I'm sorry, I'm getting too many, we've got too many weeks going here, but everything was looking very optimistic. And I think that is it. So I will, we'll open it up for questions once I can stop sharing my screen here. All right. Janine, do you want me to just read the questions again? Does that work best?
Yeah, I know that one came in pretty early, so you may have to scroll pretty far up to the top. And while you're looking, Dr. Morse, I just wanted to let you all on the call know that fall into District Health Department number 10, we did redesign the website. So on the coronavirus page, you're used to scrolling to the middle of the page and seeing a big long list there. Well, we now have a box with an icon that says school guidance or guidance for schools. So you want to click on that box now to get your information. So just wanted to let you know where you find it is changed.
Okay, so I see the first question was at 1 o'clock. Hearing a steady stream of concerns with second vaccines. I'm assuming the concern is that there are increased side effects with the second vaccine. There is an increased likelihood of side effects with the second vaccine. It is in the document I will share with you, just talk about that. It is with both vaccines. Again, just making sure they're aware of it. I put a link to a document, like a 1-page handout that helps prepare people for their vaccine, talks about what the side effects could be, advises them that they can take Tylenol or Motrin. But yeah, it definitely is a reality for some people, not everybody, but for some people. It does seem to be more prevalent for people under 55. Lots of questions regarding local school staff being able to obtain vaccines. Are there any local vaccine clinics happening specifically for school staff? So your local health department should be contacting you or should have information up on their website. Each health department is a little bit different as to how they've been trying to get that to work out, just because we have very limited amounts of vaccine and lots of people that need to be vaccinated. So if your administration hasn't heard from the health department yet, check the website and see what the instructions are on the health department, whichever county you're with. Check the health department website for that county. When our teachers are fully vaccinated, do they still need to quarantine if they're close contacts? At this point, all current public health guidance is unchanged. So yes, they have to quarantine. Everything stays the same. There may be changes coming soon. I don't want to say too much because I don't want to cause any confusion. And if things change, I don't want to cause any problems, but we've heard some mutterings that there may be some changes soon, and we will definitely let you know. But at this point, everything stays the same, whether or not you've had 1 to 12 vaccines. Not that that's possible, but again, things don't change based on vaccination status. Can you get the variant if you've been diagnosed with the first COVID within 90 days? So they have found, there's another variant in Brazil that's different, and they found, like, this one town, 75% of the people were infected and with the previous variant, and tons of them got reinfected with the new variant. And so they thought, oh gosh, immunity is not going to work. But it could have just been they got reinfected because it'd been a while. There has been at least one individual that got reinfected with this other variant from England, but it had been over 3 months. And so it's really, really too early to know. Also, the studies where we got that 90 days from, some people did get infected at 70 days or 80 days with the same old variant. So everyone's so different. It's really hard to know. But as of now, the thought is that your immunity should carry over, because even though there were several mutations, there's still several sites on the virus that are still the same. So when you make an immune response, you make tons of different antibodies. So you should hopefully still be okay. Receiving mixed information. Does the wearing of face masks have any determination in contact tracing? So no, it does not at this time. And it is in writing on the CDC webpage, but you have to really hunt for it. It's kind of buried on there, but we do not take non-medical face masks or medical face masks being worn by non-medical personnel who's not been trained to use them into consideration when determining close contacts. If a close contact has successfully isolated from a positive case, is 10 days sufficient? So yes, when you are a close contact and you need to quarantine, we have said that we are okay with the 10 days if you are okay with that. So we've really left it to your discretion if you feel comfortable. If you have concerns that maybe you have a kid or a child who maybe isn't able to really vocalize or be open or honest if they're experiencing symptoms or anything like that, and you feel more comfortable doing 14 days, that's up to you. And that still is the recommendation from the CDC is 14 days. They just give us the option to do 10 days if we want to. So yes, long story short, yes, you can do 10 days when you feel comfortable with it. We have heard on many occasions to tell our staff to get the shot wherever and whenever they are available. This is the first that I'm hearing that the vaccine needs to be received in the county a staff member works or lives. When did that change occur? And I think that was one of my health department staff was telling me that. And so I think that may just apply to when you're getting that done with the health department. Do we discourage our staff members who are able to get the shot in another county? So yeah, it's like a hospital system. If they're willing to give it in a different county, that's fine. With the county health departments, we're given certain allotments for our counties, and so if we have someone from a different health department, it kind of throws off our counts and the accounting. So again, I was asked to pass on that message. Regarding the new international travel guidelines that will be effective next week, if a staff member travels internationally over spring break but has already had both doses of their vaccine, So again, at this time, all public health recommendations are the same, even if you've been vaccinated. So unless there's new recommendations that come out, yes, they would still have to test before and after travel and stay home for at least 7 days, unless something changes. But at this time, everything you do is the same, whether or not you've had the vaccine. So can you please clarify, if we work in Clare County but live in another county, are we scheduled and we are scheduled to receive a vaccine? May we indeed receive the vaccine? So if you work in Clare County and they're coming to your office in Clare County to vaccinate, you can get it in Clare at that office place vaccination. If you live in Isabella County and you want to get it on your own in Isabella County, you can do that too. So again, you can get it where you work and or where you live. It doesn't matter, but so again, I'm just the messenger on this one, and the person who asked me to say it is not on the call. But if you're from a different health department region, a different county altogether, we ask that you go to that county where you live or where you work rather than coming to a completely unrelated county. District 10 has been in communication with the ISD superintendents in our regions, and they have met with our locals. Okay, so just reiterating that there has been communication to plan vaccination clinics, so that's good to hear. If we close a class down due to positive case and notify the parents, should we continue to notify parents if more people test positive during the closure? I would refer to the order that discusses notification. I believe the requirement is you must notify if there's been potential exposure to anyone. So for instance, if let's say on day 5, one of the students, on day 5 that they're out of school, one of the students develops symptoms, well, they would have been contagious on day 3 and therefore wouldn't have exposed anybody. So I would double check with that order because I don't trust my memory sometimes, but my belief is that you don't need to notify them because that child would not have exposed anyone working or going to or at the facility. So again, I would just double check your requirements on the notification of that. And then I guess whatever else you feel comfortable with from that standpoint. If a student has been in quarantine due to a parent and then a sibling tests positive towards the end of the quarantine, does the student's quarantine start over? Yes, it does. So it's 10 to 14 days from the last day they were exposed to someone contagious. So if you're almost done with quarantine and then you get re-exposed to somebody who's contagious, you have to restart your quarantine. So I know that's frustrating. So to be clear, if you are receiving vaccination from the health department, it should be in the county in which you live or work. If you are receiving it from a hospital, it doesn't matter where you go. Yes, that is correct. We offered to be a vaccination site, but we have not heard if we will be yet or not. Is that just because there's not a large supply? Stacy, what county are you in? Montcalm.
Dr. Morse, we're in Montcalm County. We're at Montcalm Community College.
Okay. And I believe that is just because we haven't had the volume yet to do a large clinic. So I don't know if anyone is on from Mid-Michigan District Health Department, but I'm sure that they know that you've offered and we just haven't had the supply. But I don't know if anyone else is on the phone from Mid-Michigan that can answer that. I know everyone's busy with vaccination clinics this week.
I think Marcus does know, so.
This is Haley. Yes, we have information from MCC that we have that information already. And like you said, we have lots of locations, and we'll get around to using them as we have vaccine and are able to do so.
Great. Are we seeing a high, mid, or low number of adverse reactions to the vaccination in the state of Michigan? I haven't seen actual numbers, but I mean, what I'm hearing from my offices, you know, we're seeing people with sore arms. People with second vaccines are, you know, having a bit more body aches or tiredness. I think we've had some people, very, very few, like one or two, who have had like passing out from the injection. I've not heard, I mean, to me, it has sounded very consistent with what the research studies have shown. I don't know if we have anybody from the health departments on the call who have anything to add to that, but to me, it has seemed very consistent with what the studies have shown. So then the next question is, what's the typical time frame for reactions? Usually they'll start the day following vaccination, and then they'll usually be better within 1 to 2 days after they start. So I will add, just on a personal note, I got my second dose yesterday. It definitely was worse. The first dose, the day after, my arm was a bit sore like a tetanus shot. The next day it was not too bad, and then it was gone. And it's Moderna. This one I got it. It was puffy and red and warm yesterday when I got it. Today it's very puffy and red. And when I woke up, I had a low-grade fever. I mean, it wasn't over 100. Extremely achy joints, really tired. But once I got up and took Motrin, within half an hour after taking Motrin this morning, I felt fine. But yeah, I've never had a problem with the vaccine before, so it was interesting. But I was really worried about being able to work today because I just felt so achy. But again, right after I took ibuprofen, I felt fine. And that is what we've heard from a lot of healthcare organizations, because, you know, obviously they have tons of employees that have gotten vaccinated, is that with most of them, once they've taken some ibuprofen or Tylenol, they usually have no problem working in terms of like body aches. And that's been a big one, is just body aches and fatigue. So.
Hey, Dr. Morris.
Yeah.
Hey, this is Kevin from District 10, and I can also share kind of a personal experience between my wife and I. You know, my wife got her second shot. She's a nurse in a hospital, and she was, as you said, kind of almost out of commission for a day, whereas I got my second shot and I had no issues whatsoever with it. So no achiness, no soreness, you know, no nothing. So.
They must have given you the saline.
They probably did. I'm sure they probably did.
But, you know, that really exaggerated reaction is your immune system fighting like crazy. So, you know, that is what I kept telling myself today is, well, at least I'll have a really good immune response. So anyway, another question is news on travel. So at the beginning of the talk, we did talk about the fact that starting on, I think it was the 28th, if you travel internationally, you're going to have to be tested for COVID within 3 days of your departure from that other country to come back into the US. If you don't have your negative test, you'll have to delay your trip coming back to the US. That's already in effect for travel back to the US from the United Kingdom. So that is, you know, definitely a challenge. There's been no changes on domestic travel. And then in my slides, which again we'll send out and or post on our websites, I did provide some links and resources to ways that you can look up different travel requirements or restrictions. Then another question on travel. Public health nurse here. Yep, so one of our public health nurses said that with her second dose of Pfizer, she had a headache and was achy about 4 days after. And her husband had no reaction after his Moderna. So either men are tougher, which I don't want to say that, or women just have a better immune response. But we'll let men be tougher on this one. How's that sound? But we are, again, we're seeing mainly that type of thing. We've had one call from a healthcare provider that we had some pretty swollen lymph nodes and pretty significant fever. You know, we had her get tested for COVID and it was negative, which we expected it to be. But those more significant reactions that we've heard about at least have been pretty few and far between. There was a study that came out after 1.8 million doses of Pfizer were given, there were only 21 anaphylactic reactions reported. So, you know, very small number in relation to the number of vaccines given. And 4 of those individuals did need to stay in the hospital. The rest were seen in the ER and sent home. And the ones that were seen in the hospital were also all sent home, and everyone recovered just fine. So, and all but a third of them had a history of, well, I take that back. All but, so 71% of them, going from my memory here, 71% of them had a history of an allergy. I think 33% of them had actual history of anaphylaxis before. So we're getting more and more information as we go along with this about things like that. But it seems like that really significant anaphylaxis, even though you see it in the newspaper, it actually adds up to be a pretty small number of people. Any other questions about anything? All right. Well, again, that toolkit has a lot of really good information to encourage vaccination in your staff. And I'll get the slides and the data, and then it's just a really short Word document that I have to kind of help you work through post-vaccine symptoms. So hopefully you don't have to send employees home. All right, guys. Well, let us know if you have any questions in the meantime. Otherwise, we'll talk to you next week.